Now the struggle begins, what to choose, how to go ahead. So, what after orthopedics? Most of them would go for either trauma, somebody would have thought about joint replacement, most of them, arthroscopy, sports medicine, pediatric orthopedics, orthopedic oncology. I guess very few faculties in government colleges or medical colleges teach what is foot and ankle surgery. Elective, mainly elective. Trauma, everybody is very good at it, most of them. So let's see the elective part of foot and ankle surgery, how to find the problem. So most neglected, as I said, even during residency, it's too complex, so we try to avoid it. Not a long case, not a short case, so no point, let it be. So most of this, even in practice, most of the orthopedic surgeons are unaware of what the problem is. If you don't know the problem, you cannot diagnose it, you cannot advise the treatment. There are many patients who are just running around saying there are no solutions to it, and it's quite pitiful. So what I discussed with I visit many surgeons, they said there are a lot of wound complications, so we explain, the patients come and tell, no, don't operate, don't get operated because there will be wound problem. And last but not least, it is not one of the most creamiest branch in orthopedics, even from a monetary point of view. So just if I can discuss what would be the causes of heel pain, just for all the fellows, residents who have just passed. Anybody would like to, yeah? What have you, okay. 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 Same as retrocalculus. So almost there are 10 causes of heel pain. Most of them are diagnosed with plantar fasciitis, but there are many other causes. There could be neuropathy, there can be heel fat pad atrophy. So this is important. So have you heard about Brostrom repair? Have you ever seen Brostrom repair? Apart from the DNB who are doing in a private hospital. So anybody knows what is Brostrom repair? Yeah, ATFL, great. So we are now moving from open Brostrom to arthroscopic Brostrom. So this is quite common, Lisfranc injuries. It is more neglected in the periphery, not in this region. Calcaneal fractures. I remember during my residency, all the calcaneum fractures were conserved, but it needs to be learnt about it. What are the options of ankle arthritis? Anybody? Yeah? Yeah? Yeah, so total ankle replacement, it is also now available since last 6 months. So, and flat foot, have you ever diagnosed flat foot in OPD? Have you ever seen patients with OPD? Yeah. So there are a lot of flat foot varying from pediatric, adolescent to old age. Charcot foot, Charcot arthropathy, and X-rays, leaving apart. Have you ever done X-rays? Do you know the special X-rays for foot and ankle? Or many people ask, I have seen papers, MRI foot with ankle. So there are many basic things which you should also learn, which I feel is, even if you don't choose this specialty, you should be aware of what the problems are and how to diagnose it. So let's see what is more important, how to go ahead about it. So first of all, I would suggest, like Samir Darvisal said, try to get into contact with national faculties. Since this is a newer branch, you won't find many doctors, so you can begin with joining a Indian Foot and Ankle Society. There are a lot of basic courses going around. There are a lot of conferences now. The conferences are twice a year. So try to attend the annual conferences. You can present your papers, not just elective. You can also present trauma regarding papers, cases. You should attend basic courses, cadaveric courses, learn the actual approaches for foot and ankle. So once you are knowing what the basic is, then only it is important you should go ahead and look for a fellowship. Because if you go for a fellowship after your post-graduation or after 1 year, without knowing what the basic is, then it will be very difficult for you. because out there they are too fluent and they won't have much time to teach you the basics. So it is better if you learn the basics first. Get to know about the recent trends, meet the colleagues and fellowship opportunities. So Indian Foot and Ankle Society has fellowship opportunities, national as well as international. So like I said, understand the basics, how to diagnose, clinical diagnosis. In foot and ankle, clinical diagnosis is the most important. It is also important in other fields, but more than radiological or X-ray, it's the clinical diagnosis. Exposure to various surgeries, elective surgeries, which I doubt you might have not seen. Good hands-on experience in cadaveric courses you can have with attachment with national faculties, and learn the recent advances. It is still not late, but learn the anatomy first, because the anatomy is quite confusing. If you don't know the anatomy, you cannot go ahead about it. Learn various surgical exposures. Start preparing during your bond period. So not necessarily you start applying for the fellowships, but obviously if you can get a fellowship, I feel you can go for some observership, learn how the thing is, come back, practice, and then go for a good fellowship where you can know all the basics and all. So decide where you want to go. There are many countries, UK, US, Korea, Singapore, Israel, Spain, Switzerland, everywhere there are fellowships going on. So UK is most commonly known for foot and ankle, and UK fellowships are quite better. You get good hands-on. In US, we'll see in the next slides. So national fellowships, there are everywhere, all around India, Baroda, Delhi, Pune, Mumbai, Nagpur, Jaipur, Bangalore, and many more. So we'll start about applying for a national fellowship. You can directly approach to the surgeon, you can mail them, have some references, that is better. Or you can just go as an observer for 2 weeks and see whether you are developing interest in that field or not. If you are not developing interest, then you can forget it. There is no point in going and applying for a fellowship. So you go for some observership where you can understand what the surgeries are and does it excite you. So we'll talk about UK first. So I would thank Dr. Dhrumin Sangoi because he has been all through this part. I have not been through this. So you apply for MRCS Part A, Part B, and IELTS, and you clear this. This is the best pathway to enter into UK and go for fellowships. You apply for GMC registration, and then you look for jobs, enter into any job, whichever you get first, you enter the system and then try to look for your specialty. In UK, you have that advantage. You can go into one unit, then you can develop your rapport with colleagues and go into another unit like a dedicated knee, shoulder or foot and ankle or arthroplasty, spine. So look for registrar jobs because there your CV builds up, ST3 and above. Alternate pathways are PLAB, MTI and MCH. So you can so PLAB, MTI, MCH, you can go into the fellowship, but they are not so creamy and they won't build up your CV in UK. Over here, it doesn't matter much. So like I said, apply, look for foot and ankle jobs, meet the consultants, connect them through mail, LinkedIn, courses, get their emails, and connecting people is the most important thing in your fellowship. Spend 1 or 2 years as a registrar and try to clear FRCS trauma orth because that builds up your CV a lot when you come back to India or even if you are planning to stay in UK. Regarding MCH, it has less importance in UK per se, but if you come back with MCH over in India, it obviously builds up your CV. So decide if you wish to stay or come back. So these are the list of hospitals. You can just have a click. I won't say in detail about it because you can find it later on or you can connect me. So try to attend for these conferences, these courses. These courses are now also available in India. Like British Orthopaedic Foot and Ankle Society has annual course in India for 2 or 3 days. It's a cadaveric course. You can also visit the King's Diabetic Foot and Ankle Symposium. It's there in UK. You can go there and attend and learn about what Charco foot is. There's a very complete different approach for that. When you are in UK, you can also go for these courses. Stanmore foot and ankle course is one of the best ones. Now let's talk about US. So it's good for hands-on experience, but yeah, it needs the MLE. There are 3 steps. Try step 1, 2, 3, CKCS. Try to clear those steps. If you are planning for US earlier, then you should try and clear those steps during your residency. Clear IELTS, and without USMLE, you won't get a hands-on fellowship. You can go for an observership in US for 3 months, 6 months with your recommendation with your national faculties. Those are good for learning what foot and ankle is, but developing your skills, you can either come back and join a registrar job somewhere, or try to learn about the skills, and or else you can apply for accredited fellowships, which are slightly difficult to get in US. To enter US, it's like you go for apply for a research fellowship. It does not require MLE. You apply for a research fellowship, try to clear all the steps during your research fellowships, and then apply for a fellowship. You can get a trauma fellowship very soon, and then you can switch over to any of the specialty you want. So there are dedicated foot and ankle surgeons in USA. There's different degree for that. DPM, DO, they are known as podiatrist. They are doing only foot and ankle. So much of foot and ankle work in US that you cannot believe. I mean, when I went there, I was surprised to see they are doing 13, 14 cases a day. So there's so much of work over there. So obviously they are not allowed to go above the ankle. So if any patient requires BK amputation, they cannot do it and they have to refer it. So I had a very good exposure for ankle arthroscopy, ankle replacements. Now they are doing revision ankle replacements, which is 15, 20 years after the total ankle replacement. So there are many forefoot surgeries, bunions and all very commonly seen, and commonly people are aware that there are solutions. Here we have seen so much of crooked foot, but they don't want it. Why? Because they have the fear, I will not walk. There are many private foot and ankle centers who give fellowship and observerships, so they are also quite lucrative. So various centers where you can approach, you can apply online, you can get observership without any examination. Obviously, you can go there, clear the steps and join a proper accredited fellowship, or you can come back and do your training over here. In Singapore, also there is 2-3 hospitals, they have started foot and ankle fellowships. Singapore General Hospital, Changi, NUH, you can apply online. They have waiting period of around 2 years. They get good hands-on, it's 6-month fellowship. Earlier you used to get a stipend, now I doubt whether you get a stipend or not. But I feel if you can get anywhere, it's good. In Israel, this Dr. Ezekiel Palmanovich, he is quite famous and he does a lot of work. You can approach him, or you can connect him through LinkedIn. He has his profile. He has started a fellowship through IFASCON. So in Europe, in Sweden, Nick Van Dyke, Leif Reed, they are the founders of total ankle replacements in Europe. Jody Vega is very well known for arthroscopic, endoscopic and tendinoscopy procedures. So what's new? So nowadays, arthroscopy, ankle arthroscopy, you would say what is ankle arthroscopy indicated for? So there are a lot of things, arthroscopic brostrom, talus OCD, we do ankle fusions, arthroscopic. So body removal and synovectomy comes later. Tendinoscopy is for Hageland TAs, tendinoscopy for perineal tendinoscopy. Mostly it is diagnostic, not therapeutic. I would just rush in. MIS surgeries in foot and ankle with just a single hole, you can just correct this complete deformity. We get a special burr for that. So this is one of the cases which are quite neglected. So we come to total ankle replacement. This is presently available in India. It's the 3rd generation Hinterman. The cost is a bit of concern, but yeah, it is still available. You can give options. Charcot foot, most of them are neglected, go into amputation, 90% of them. So we can save them. Flat foot, there are many procedures for flat foot. It is important to understand, diagnose which stage, and you can learn about these surgeries because it's quite new. I entered into this specialty knowing that very few surgeons are there. It's completely niche branch. You don't know anything in your residency. So I had the curiosity to go into this. And yeah, so last, you should learn when to operate. More importantly, when not to operate. You should see the plan of action or patient expectation, what the patient wants, because most of them are electives. There are more important intraoperative decisions you have to make. This is not that you have to go with a single pre-minded approach that I have to do this, because all surgeries have 2 or 3 surgeries in that. So if you go with one, then you can follow the other. So you have to keep your mind open, learn various techniques, let the patient demand surgery. Because patients don't know there is surgical option, if you tell them surgery, then they go away. So you let them demand surgery from you. Thank you.